Imagine being able to be pain-free without numbness tingling to your arms or to your legs. I help and enable people like you with families like yours to be able to live longer in this planet. At this time, I want to ask you permission to help you. The choice is yours. Imagine being able to fix your body's ability to stand upright automatically without constantly wasting energy to stand straight and being always conscious about your posture. Imagine a drug-free and non-invasive treatment that helps you to feel good, prevents you from having a slouched posture, feeling embarrassed by your looks, and being always self-conscious about it in front of others. My name is Dr. Maz. I practice at MedWell Sports Medicine and Physical Therapy Center in Midland Park, New Jersey. We are a panel of doctors and therapists working together at one location. I'm also the author of this book, How to Live Pain-Free and Happy, Drug-Free, Non-Invasive, Non-Chemical, Non-Surgical Solutions for Resolving Chronic Problems, Chronic Biostructural Problems, Postural Problems. I wrote the book. You're about to hear some groundbreaking, transformational knowledge which has helped hundreds of patients successfully nationwide. I've studied many years of latest research in diagnosis and treatment of functional conditions, as well as fixing your posture from head to toe. I'm also trained by the country's leading expert, Dr. Jesse Jodkowitz, who is the founder of Advanced Biostructural Correction. Let's discuss why this assessment and treatment is very important to your health. But before we do that, I want you to understand when I talk about your posture, I'm not talking about just having a slouched posture. I'm talking about your position of bones on top of each other. That includes the position of your head, your spine, your upper extremities and lower extremities. Your posture is a byproduct of your life activities. If you have an injured posture pattern, for example, if you have a forward head tilt, slouched mid-back, phone neck, scoliosis, or having one hip higher than the other, it needs to be corrected because posture problems are not self-correcting. You need to get treatment for it. Posture problems cannot fix themselves. Posture correction program is a program to renew, revitalize, and rejuvenate your body and take years off your spine. Posture problems affect your appearance, affects your every physiologic function from breathing to normal hormone production. It facilitates pain. It causes recurrent headaches, affects your mood, blood pressure. Lung capacity in most cases are influenced by bad posture.
I came to MedWell with horrible back pain. The doctors here said that I had bad posture and a bone out of alignment. They recommended the advanced biostructural correction. I was a little hesitant at first because of the name, but after a few treatments, my back and my posture were 100% better. I'm standing up straight, I'm sitting up straight, I'm actually breathing better too. It's just amazing what they can do here, and it's all thanks to MedWell that I can actually stand up straight and not have this horrible back pain.
Structural problems causes bad posture, and bad posture causes functional problems. For example, your backbone, called vertebral column, consists of multiple small bones, one on top of each other. Between these bones, there are discs and nerves. Now, if these bones are misaligned, or for a lack of a better term, they are fixated, these bones are not only putting pressure on the supporting musculature around them, they also put pressure on the nerves and the discs. You may also cause problems with your organs because the specific nerve that comes out between these two bones, they go to an organ. So if the nerve does not send enough signals to that organ is not going to work properly and cause problems with functioning of that organ. Because of a bad posture, the nerves in your upper neck may become inflamed due to constant pressure. And this may be associated with your headaches and breathing problems. The nerves in your neck may weaken your immune system. And this may be associated with your frequent allergies and colds that you get. Postural distortions may weaken your thyroid gland, metabolism, and immune system. Can cause fatigue, decreased energy levels, and sleep problems. Because of bad posture, the nerves in your mid-back may become pinched and weaken your stomach. And this may be the reason you have been getting heartburn and bloating after a meal. The nerves in your mid-back may weaken your pancreas, and this may be associated with your hypoglycemia. Because of bad posture in your lower back, the nerves in your lumbar spine may be being pinched and weaken your bladder, and this may be associated with your bladder infections.
I'm really impressed by what a warm-hearted, genuine human being he is. He's very caring. He takes what he does very seriously, and hearing him speak, he has a wonderful system, and he really cares really very deeply that we all have better health, that we live much more balanced lives. And I just want to thank you, Dr. Maz. It's just been an honor to get to meet you.
If the middle of your back is not aligned where the nerves in that area go to your lungs or stomach, you may acquire breathing problems or frequent bloating, indigestion, and stomach issues. If the bones in your lower back are misaligned, as I mentioned, that could cause even intestinal problems, besides the urinary tract infections and postural pattern disturbance. The reason doctors most often do not evaluate your posture and educate you about bad effects of your posture is because they're not trained how to assess your posture, and more importantly, how to fix your posture in a way that is consistent, predictable, replicatable, duplicatable. I want you to understand the bone misalignments or fixations mean either the bone is stuck in a position that it cannot move, or it's locked. The bones cannot move in a direction that they should. As a result, you will not be able to do certain movements as good as you should be able to do certain movements. In addition, you start having appearance and functional issues. Unfortunately, when the bones they get locked, the bones cannot self-correct them. You need to get that out of your head. If with exercise you can self-correct the bones, you cannot self-correct the bones. Your misalignments and posture problems are not a muscle problem. This is where a lot of people, including doctors, are misinformed. The problem is joints and skeletal problems, not a muscular problem. There are many reasons and causes of misalignments that causes the bone to lock. It could be due to emotional stress, such as going through a lot of stress and anxiety in life, divorce. It could be chemical stress, such as smoking and alcohol use, medications. It could be a physical stress, such as having a sedentary lifestyle, having a car accident, being behind a computer all day long, not exercising, or even exercising could cause structural stress. Doing your daily chores inappropriately could cause misalignments and fixations. So you do not have to intentionally do something wrong to create stress on your body. All of us need some sort of biostructural correction. All of us need some type of a maintenance for our body to be done routinely. Similarly to our cars that we take for a tune-up, no matter if the car is a $2,000 car, $5,000 car, or a $100,000 car. All cars need to be tuned up. Well, when was the last time you tuned up your body?
Dr. Maz transformed my life in just a few minutes. A few simple moves. He gave me a great exam. He actually, if you see me, I'm standing up taller. There's no pains, there's less aches. And that was just after a few minutes. What I'm really excited about is spending more time with him, going through this complete program that will not just transform my posture, my aches and pains, also transform my weight. So, thank you, Dr. Maz.
Advanced biostructural correction assessment is a hands-on evaluation and treatment designed to fix the areas of fixations in your body, on your spine, in your extremities, where the bones, they are locked, following by fixing those areas of the body before you leave on your first visit. No one or any other method that I know can claim this. Our goal is to provide permanent improvement in your resting posture. As a result, you will be able to be more efficient in your daily chores, activities, and sport. Every day, we have some sort of a success with our patients receiving ABC treatment. A patient who was a swimmer, after receiving series of ABC treatment, took 1 full minute off her mile time. It is not unusual to have stories like this to be told to us. A trained doctor must analyze your spinal and extremity bones for their ability to properly move, and if they don't move, to correct it with ABC treatment. If you have a sleeping problem, the solution is not Tylenol PM or Ambien or time-released Ambien. We need to find the cause, and in some cases, there are structural spinal issues that must get fixed. Usually when our patients, they get ABC treatment routinely, they will benefit from having a better sleep. Yes, they do. If you feel always you're tired and fatigued, the solution is not an energy drink or a Red Bull. Give me a break. We need to find the cause and fix the cause. I talked about this on separate DVDs. My goal is to add value to your life so you're able to do what you want to do. Spend quality time with your family. Being able to participate with sports with your children. Many of our patients, they're able to do things that they were not able to do for years or even decades after this treatment. I want you to understand, good posture does not mean standing up straight consciously. It means having your body be up straight automatically with no effort. That is the key, with no effort. Your body should stay upright with no muscular effort. This is exactly the opposite of what you have been taught. Our parents kept on telling us to sit up straight, sit upright. And our body would get so exhausted, use a lot of energy constantly trying to stay upright and constantly sit up straight. And after the people around us, they were gone, we would slouch because nobody was watching, because we have no more calories to burn to sit up straight. It would slouch the original posture.
I can tell when I first came, I did not feel up to par at all. And now I feel I feel renewed, and I can strengthen and stand up straight as though I were about 25 years old.
I feel so good. I came 9 o'clock, it's 11 o'clock now. I'm already finished my first treatment, and I feel 80% better.
We need to achieve automatic, proper alignment and balance of the skeletal structures. This is done by proper assessment and treatment called advanced biostructural correction. We have a method utilizing ABC to analyze and determine whether your bones are in proper placement and move them in a direction that they should. If they are, we leave them alone. If they're not, we fix them. Bracing does not work. Bracing, it is trying to use muscle strength to acquire upright posture, where the problem is not a muscular problem to begin with. It makes your muscles even lazy by making the muscles not to do the work that they're supposed to. That is why bracing does not work. Sitting up straight does not work. Why? You just use so much energy to sit up straight that you get tired and exhausted. And that is why when people are not looking at you, you relax and you become slouched. You have a slouched posture. Exercise does not work. Don't get me wrong. I'm not saying exercise is bad. Exercise is great. Everybody needs to exercise. But exercise is not good to fix your posture. It's not going to fix your posture, because the problem is not a muscular problem. Yesterday I went to the gym. I saw a lady who has been receiving personal training from a qualified personal trainer. For the past 3 years, I go and see her. She has a very, very bad slouched posture, which it's not corrected. Why? Because the problem is not a muscular problem. The treatment works great. This treatment works great on athletes. Why? Because athletes, they have the muscular strength. We have to fix their joints, fix their meninges in their spine by certain maneuvers and movements. The athletes focus on muscle strengthening and quickness. Well, if you do not have proper and correct bone alignment and function of the joints, you cannot get the results that you're looking for without proper biostructural function. That is why you see many athletes with rounded shoulders, slouched posture, and forward neck. So that's what you want to prevent. I've treated numerous UFC fighters, ultimate fighting champions. The results are incredible, because it increases their performance and quickness. misalignments that I'm talking about, they're commonly due to having many years of poor habits, poor standing, poor sitting, and walking. Advanced biostructural correction enforces the body to automatically stay upright with no effort on your part. We have defined and designed a treatment plan utilizing advanced biostructural correction with few other therapies that has helped hundreds of patients successfully. It is non-invasive, non-surgical, non-chemical. It works great on scoliosis sufferers. Scoliosis is one of the biggest mismanaged condition in the United States. Many of the school systems that they have scoliosis check, the people who do scoliosis check, they don't know how to check scoliosis properly, and they're not trained by a trained advanced biostructural correction practitioner. Many scoliosis sufferers, they could benefit from advanced biostructural correction. The sooner, the better. It works great on elderly, adults, athletes, and children.
This man is more than just a doctor of chiropractics. This man is more than a healer. This man is a man with heart and dignity and character. If you have an opportunity to meet Dr. Maz, he is a doctor that other healers go to. I didn't know that. He's trained some of the best of the best. He truly cares. He's published, he has integrity, and he helps people eliminate pain.
Now, this is the scary part. Results appear in most cases on your first visit. This is why you see many pre and post pictures in this DVD and in my books and in the office with the patients with having same clothes on, because we took a picture before treatment and after treatment. These are the patients who wanted to share their success with others. Results are consistent, predictable, duplicatable, replicatable. Many people either suffer from some sort of a breathing problem, or they can enhance their breathing. Many of our patients experience better breathing after this treatment before leaving the office. Let me repeat. Many of our patients feel better breathing before leaving this office.
This is my first visit at MedWell. I had breathing issues and also my posture complaints. After my first visit, about 25 minutes here, I'm breathing 100% better, and also my posture, I have a hard time slouching. It's a 180 degree difference. I would definitely recommend this to anybody.
Before and after we do our treatment, we ask patients to breathe in and out and let the body slump, let the body go. Before and after treatment, we ask the patients to do a squat and tell us what bothers them the most. To this day, I have not even had one patient who did not express that they're breathing better and or be able to do a better squat either faster or with less problems. That includes 80-year-old patients that we have treated. That includes patients with knee replacement, hip replacements. We have had many children, adults, elderly, who have had noticeable results on their first visit. Patients become happier as well. Yes, I know you're getting scared by me telling you this. Yes, patients, most often, they become happier after this treatment because they need less energy and effort to be wasted to have their posture upright. In addition, when we get the pressure off the nerves in the neck area, they have a better circulation to their brain and to their face. That's why when they have more circulation, more oxygen, you're happier. That's why their face gets a little red after treatment as well, because there's more proper amount of circulation to their face. Your lungs even get filled better. Why? Because your lungs has a top portion and a bottom portion. The top portion of your lungs, a lot of times it doesn't get filled up with air as you breathe. Why? Because the first rib is putting pressure on your lung all day long. So I don't claim that I have a great posture, but so your lungs becomes like this. Athletes, you see a lot this. Kids, you see this, because everything is based on flexion and extension in our body. We never go like this. So what happens, the top portion of the lung doesn't get air in as you breathe. Therefore, you breathe more frequently. For breathing more frequently, you need to use more energy. So that's number one, that your body goes under stress. Number two, when the top portion of your lung doesn't fill up with air, you have to breathe more rapidly to get enough oxygen for your body to survive. When we adjust your first rib, when we provide this advanced biostructural correction on first rib, which 90% of the patients need it, we provide that to them, you're going to breathe easier and less frequently, because you don't need to breathe as frequently to get enough oxygen for your body. That is why your face becomes more red and you become happier as well, because you don't have to breathe hard. If you see some pre and post pictures, patients look taller on the after pictures. Why? Because your posture goes upright and the patient generally gain like an inch and an inch and a half, because they're upright automatically, because there's less stress on their spine, their head, and their extremities. The numbness in your hand, numerous times it has gone away. Why? Because their first rib is not putting pressure on your brachial plexus, and that's why you have the numbness. So you go to neurologist, you do the nerve testing, you go see this doctor, take that medication. That medication, most often, that could help the numbness in your arms as well.
Dr. Maz is one of the most caring, compassionate people that I've ever met. Not only is he one of the top of his profession and able to truly help people, but he really cares. If you need help, go see Dr. Maz. You'll be glad you did.
In most cases, you cannot even slump if you even want to. It is hard to slump. Yes, it is hard to slump. Opposite of now, where you're either slumping watching this video, or you feel comfortable slumping when nobody's around. We provide, in addition to advanced biostructural correction, we provide arthrostim treatment. Arthrostim treatment is a device that stimulates joint motion and mobility. In this office, we use state-of-the-art technology in order to get great results.
I'm happy to say in the visits that I've had at MedWell, I have come a long way. My first appointment, I needed assistance from the car to here. How I got into the building, I don't even remember. Now, I am walking on my own. I'm able to dress myself without screaming in pain. I just don't know what else to say except that I am almost 100% mended, and it's thanks to MedWell. My pain is zero in comparison to the excruciating pain I had when I came in.
Another treatment which has helped many of our patients, and it's part of our protocol for posture correction, is whole body vibration. This device, it provides lateral movement to your body. Why? Because as a human, we are used to flex or extend with anything that we do. Our body doesn't move laterally. Now the whole body vibration unit, it stimulates lateral movements. A lot of people after coming off of this machine, they feel they're taller, they can walk easier and faster. Why? Because we introduced mobility to your joints in motions that they're not used to. That's why it works great. It works great for ankle pain sufferers, knee pain, knee and hip replacement patients, back pain patients. It moves your pelvis laterally. It feels great. You may get a specific type of a posture brace in this office only on a case of need for a limited time. We have had many patients, if you have a compression fracture in your lower back or mid back, which is most often, that patient requires a posture brace that is designed specifically for compression fracture, not to just wear to make you feel good. Okay? So that will help the compression fracture. A lot of times these fractures have been there for several years or decades. We have seen reversed faulty posture when we give these patients the posture brace that I'm talking about, in addition to advanced biostructural correction and the other therapies that I mentioned. You may need custom-made foot orthotics. If your feet and gait is not proper, that affects your whole entire body and your whole posture. We do 100% custom-made foot orthotics designed specifically for your feet. We scan your feet and give it to a computer, the results, so the custom-made foot orthotics that you get, it's 100% for you and your own feet. You're going to also get hands-on physical therapy in this office in order to assist you in getting rid of the tension points and the tight areas, followed by a strengthening program. Oxygen treatment is also very, very important part of the care, which is commonly missed. Save the best for the last. This treatment by far has helped many of our patients with postural problems, chronic pain, fatigue, fibromyalgia, spinal muscle spasm, chronic spinal muscle spasm, disc herniations, disc bulges, migraine headache sufferers, attention deficit disorder, attention deficit hyperactivity disorder, yes, stress and anxiety symptoms, and I'm going to tell you why it's been helping them. The reason for that, this is a neurologic phenomenon that in the back of your brain there is an area called cerebellum. The cerebellum is the most oxygen dependent part of your body. What happens when the cerebellum doesn't have enough oxygen, it doesn't work good. When the cerebellum has enough oxygen, it works good. Cerebellum, one of its job is to take care of the postural muscles not to go to spasm. If the cerebellum doesn't have enough oxygen, it goes through a stage called oxidative phosphorylation. And as a result, the muscles go to spasm. The problem is that as you age, your ability to utilize oxygen diminishes automatically, about 1% a year after the age of 25. That means if you're 50 years old now, your ability to utilize oxygen has diminished 25% already. Next year is going to be 26%. So we all may be oxygen deprived. Now, before I go on, I just want you to know that you may go to your primary care physician. He or she may say that you're not oxygen deprived. What he or she is talking about, he's talking about your cardiovascular system not being oxygen deprived. What I'm talking about your neurological system. Neurologically, you need more oxygen to work efficiently as opposed to your cardiovascular system.
Hi, I'm Mary Kerrigan Ward. I'm a 47-year-old mother of 2 children, and I've had chronic lower back, shoulder, and neck pain for many years now. I have sought chiropractic services in the back, and it never seemed to make me any better. I've been here for only 5 visits, and it's the first time I can say in years that I am pain-free. I'm going to continue on a wellness program because that's supposed to help, but I'm just recommending this MedWell to everyone because it's great. I feel good.
So what we do neurologically to relax your spinal muscles is we give you supervised oxygen treatment on-site prescribed by our doctors in conjunction with the treatments that we mentioned, because it works great. So if you're serious about correcting your posture, correcting your stand to be upright with no effort on your part, if you're serious about having more energy, having a better movement and performance, being able to play with your children, being able to do the things that you like to do, being able to participate in the sports that you want to be participating, being able to sit for a long time, stand for a long time as your job would require, you need to contact our office. If you don't care about your health, do not contact my office. Our office is not for you. I don't need to do this anymore. I can stop tomorrow. I do this because my passion is to help people to live a better life and add value to your life. You can get treatment or not get treatment. It's not going to make a difference in my life, but it's going to make a difference in your life. I'm asking you permission to help you. If you're serious about getting rid of your symptoms, having your symptoms handled, our office is for you. Contact 201-848-8000. Not everyone is accepted for care. I want you to understand this. Not everyone is accepted for care. We only accept patients who we feel we can help. So if what we have said to you has made sense to you, you need to contact our office and make an appointment with one of our new patient coordinators. Can we guarantee the treatment is going to work? Absolutely not. We cannot guarantee anything in healthcare. Are we successful? Yes, very successful. This is Dr. Maz saying thank you for watching this video, and I'm looking forward to seeing you in the future. You can call us at 201-848-8000. Yes, we accept most insurance plans, and God bless you and your whole family.